The Senate Committee on Health, Education, Labor, and Pensions will please come to order. Again, Senator Kennedy, Bobby Kennedy, thank you for appearing before the committee and for your willingness to serve our country as your family has served our country. You and I have talked at length about a variety of issues impacting Americans' health. These have been candid conversations, and I very much appreciate your willingness to engage. And there are many things you and I agree on. We're in total agreement on the need to address ultra-processed food, to reduce obesity. And obesity, of course, the leading cause of chronic disease and therefore of shorter lifespans. And this will be a priority in this committee, and I look forward to collaborating with you if you are confirmed. But it's no secret, I have some reservations about your past positions on vaccines and a couple other issues. And so we know a lot about you. I'll tell you a little bit about myself. Before I entered politics or even thought about running for office, I practiced medicine for 30 years, working in public hospitals in California and Louisiana, specializing in liver disease, caring for those who otherwise would not have had a specialist. If you will, dedicating my life to saving lives, that is, being a doctor. Now, there is a moment in my career that really informs me now. In the early 2000s, I was loading a patient onto an air ambulance, an 18-year-old young woman, to go to get a liver transplant from acute liver failure due to hepatitis B. Barely an adult, her entire life ahead of her, all the hopes and dreams she might want, the children, the grandchildren, the future generations, wiped away if she did not get to the LSU hospital in Shreveport for an emergency transplant. Now, the transplant, an invasive, in 2000, $250,000 surgery that had a 5 to 10% mortality rate, but even if she survived, would leave her with a liver transplant and hospital bills every year of $50,000. And as she took off, it was the worst day of my medical career, because I thought $50 of vaccines could have prevented this all. And that was an inflection point in my career. And since then, I've tried to do everything I can to make sure I never have to speak to another parent about their child dying due to a vaccine-preventable disease. So I worked with community and business leaders to form a public-private partnership in the capital region of Louisiana. We vaccinated 36,000 children for hepatitis B, and since the CDC and the ACIP have recommended universal vaccination for children, the number of acute hepatitis B cases in our country has declined by almost 90%. So as a physician who's been involved in immunization programs, I've seen the benefits of vaccinations. I know they save lives. I know they're a crucial part of keeping our nation healthy. Now, Bobby, I've learned you got a tremendous following. My phone blows up with people who really follow you. And there are many who trust you more than they trust their own physician. And so the question I need to have answered is, what will you do with that trust? Whether it's justified or not, and you may not want this to be the case, but I have constituents who partly credit you for their decision to not vaccinate their child. Now, that's a real conversation. And I'm hearing from them, and they want you confirmed. Now, you're going to tell us this week, as you did, I think you'll tell us today, as you did in Finance Committee yesterday, that you're pro-vaccine. So what will you tell the American mother? Will you tell her to vaccinate her child or to not? Or to have a conversation with her doctor, but for many that will be permission to not vaccinate their child. We know that to be the case. So your past of undermining confidence in vaccines with unfounded or misleading arguments concerns me. Can I trust that that is now in the past? Can data and information change your opinion, or will you only look for data supporting a predetermined conclusion? This is imperative. You will have the responsibility to restore trust in our public health institutions in this position you have. Now, let's turn a little political. I want President Trump to be successful. It's important for our country. Any action you take as HHS Secretary will shape his legacy, and we both want that legacy to be positive. So, thank you for coming before the committee, for being willing to serve, and I look forward to today's conversation. And with that, I yield to my ranking member, Senator Sanders.